Good day viewers and subscribers, welcome back to my channel. This is Girls Connection, the World Connection. Please remember to subscribe, like and share. Also click the notification bell to receive daily news updates locally and internationally. 4 strokes at age 9. Child suffers setback in 3 years as mom makes desperate plea for help. Claudette Grant his name-breaking point. Her greatest wish, she confessed, is for her 9-year-old daughter, Annalisa Hall, to get over her illness and be well again. In the last 3 years, Annalisa has suffered 4 strokes, and the pain of seeing her daughter in that state has been made worse by the financial strain Grant faces to get medical treatment for her child. Every day, my dream is for the sickness to just leave her and she come back normal, Grant said. She was always happy. She would read and spell her words and try to do every little thing for herself before the strokes. Sometimes she would say she want to help me for wash and so on. Sometimes me give her a little one something and she hold it in one hand, but the next one can't go nowhere. Little Annalisa's problem started in 2018, a few years after being diagnosed with hemoglobin HB, SS sickle cell disease. The most common type of sickle cell disease, which occurs when a person inherits copies of the hemoglobin S gene from both parents. The 3rd stroke hit the child in 2019, and just last month she suffered the 4th. God alone knows how painful it is at times. Sometimes I want to cry, but sometimes it feels like I can't cry, the distraught mother said. According to Professor Jennifer Knight Madden, director of the Caribbean Institute for Health Research's Sickle Cell Unit at the University of the West Indies, Mona, sickle cell disease is very common in Jamaica. 1 out of every 150 babies in the island have the disease, which can cause serious complications such as stroke because the disease impairs the lining of the blood cells in different parts of the body, including the brain. Whenever these blood cells become badly damaged and patients develop moya, a weird condition in which blood vessels that supply blood to the brain become narrowed, children are sometimes referred for surgery. Professor Knight Madden said when this occurs, the sickle cell unit will do an ultrasound on brain vessels to find evidence of blockage. Then they try to put patients on hydroxyurea to help prevent another stroke. Some patients respond well to the drug, while others do not. Sickle cell is very common, so we encourage all Jamaicans to know what their status is and their partner's status so they can make informed decisions. If you have a trait, ideally, you wouldn't want to have a partner who also has a trait unless you are willing to have a child with sickle cell disease, Professor Knight Madden explained. Stroke is not uncommon. By the time children with SS disease reach 15, approximately 6% will have a stroke. Once you have 1 stroke, the chance of another one increases with each subsequent stroke. In places where there is sufficient blood supply, the approach is to use 1 transfusion every 4 weeks to decrease the risk of a stroke, she added. Usually, if they present having a stroke, we would do a transfusion in the acute setting to try decrease the chances of the stroke extending, but we don't have the blood resources to do chronic transfusion. However, Jamaica is one of the places that really pioneer the use of hydroxyurea, which is a medication used to decrease the severity of sickle cell symptoms. We have shown that while it is not as good as transfusion, it definitely can help to decrease the chances of stroke, Professor Knight Madden said. The availability of treatment offers some amount of hope for Annalisa and her mother, but Grant is finding it difficult to buy medication, pay rent and purchase food from the small salary she receives from a job she managed to secure just 3 weeks ago after going without employment for months. The medication cost like $6,000 for the month. Taxi charged me like $2,000 to get to the sickle cell unit every month. The doctor has recommended her to do a magnetic resonance imaging because they want to do a test on her chest. When I check it out, they say it is $68,000. Me not have them type of money there at this present moment, she said. Me just wish me could have get some kind of treatment or something, the mother said with tears in her eyes. Anyone wishing to help can reach Grant at 876-589-1468. This is Girls Connection, the World Connection. Please remember to subscribe, like and share. Also leave a comment in the comment section down below. Thank you.